Robert Lelouch, board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about circumcision. So circumcision is removing the foreskin off the end of the penis in newborn babies. I'm not addressing adults, I don't do that. But circumcision is an elective procedure. It's done for social reasons, religious reasons. It's commonly done, but the benefits are only very slightly higher than not doing it, and there are some risks, but they're very slow. They're very low. So overall, there's a slightly reduced chance of getting sexually transmitted infections, transmitting those infections of the penis, a very slight reduction in the risk of cancer of the penis, but that's a very rare infection. Also, lower chance of urinary infections, but they're pretty uncommon in men. So overall, it's not a strong enough reason to encourage universal recommendation for circumcisions. However, there's a tiny advantage over not doing it, and that's more of a personal choice and a family choice to be made. That being said, it's very simple. The risks are tiny. All surgeries have a risk of infection, anesthesia, injury to adjacent organs, but bleeding. The risks are very, very tiny, but never zero. An anesthetic is used, depends on which procedure is done. The procedure I do takes under a minute, and so I don't use any anesthetic. Just like if you get your blood drawn or you get an IV, you don't get an anesthetic for that. There are longer procedures with different devices that where I would use an anesthetic. You have to talk to your physician to see whether or not they use it. Overall, it's whatever is done to make the safest, quickest, and least uncomfortable procedure. The circumcision afterwards, the penis will swell a little bit, might get a little red. It takes about 7 to 10 days to heal up. During that time, we encourage you to use some Vaseline so the penis doesn't stick to the diaper. And otherwise, try to keep it clean with just water or soap and water. You may use baby wipes, but sometimes they can irritate. They have a little irritation to them, and some recommend avoiding them. I find it to see how your baby responds is okay. Of course, if they have a bowel movement and get it all over them, you need to hose that off. The fact that the swelling occurs is normal, but if your baby starts to have increasing redness, a fever, signs of infection, and you're concerned, be sure and talk to your physician. And also any difficulties voiding after the circumcision is done. We always observe them before they go to void, but you should know that and be sure that they're voiding carefully, having wet diapers, have wet lips, and still doing okay. After that week, for the next 2 months, I recommend that you keep the foreskin down. So every time you change the diaper, you should see the whole head of the penis. This penis can shrink and grow, and the skin can go hike up there and stick there. And even though it's uncommon, they might need another surgical procedure to get it down. So it's easier to just ensure and make it down, to keep the foreskin down. If you're not sure, ask your husband or your pediatrician or your physician who does the procedure. Not everyone recommends this. It's from my personal experience of what I've observed that it reduces this very small but not zero risk of getting an adhesion of the skin that needs a subsequent surgery. So overall, the procedure is quick and simple. The risks are never zero, but they're quite small. And with some simple care, your baby should do fine. I hope you found this information of use. Please leave your comments. Thank you.